Francisco General Hospital is known for treating the most vulnerable people, in their words, with compassion and respect.
But sometimes reaching out to those on the streets is a challenge. At times, it comes too late, and now there's a new type of care that provides surgeries for the homeless before their condition becomes an emergency.
ABC 7 News Building a Better Bay Area reporter Leanne Melendez is here now to explain. Leanne?
Yeah, and we know that by the time they get to the emergency room, there could be complications. And not to mention, ending up in the emergency room costs a boatload of money. So the surgery division at San Francisco General sat down with the health department to talk about a way to get to unhoused people who may need a procedure now before it becomes a major problem. That's how they came up with Project Reach.
Lonnie Poole has been in and out of homelessness since he was 14 years old. He's 65.
Well, I've been on the streets here most of my life.
Once a heavy meth user, Lonnie has lived with HIV for the past 37 years.
How did you contract it?
Needles.
Needles.
For those like Lonnie who live on the streets, being exposed to the elements and a lack of proper care tend to catch up with them.
You started feeling pain, right? Did you know what it was?
Yeah, I had it 2 or 3 years. It hurt me, but it just never hurt. But then it started hurting.
People will actually usually feel some pain or bulging in their groin, and it kind of affects their ability to walk and stand up for a long period of time.
The scheduled surgery was performed through a pilot program called Project Reach at San Francisco General Hospital. People with medical conditions who are unhoused are offered procedures early on before landing in the emergency room. Dr. Marissa Beck is one of the people who started the surgical program.
If we let it advance too much, where then they do need to come to the ER, sometimes it's a much bigger operation. They have to stay admitted in the hospital, and as you say, it costs, the health system more.
Outreach teams operating during the day and night are the ones in direct contact with those who need this care. One of the challenges they face is convincing them to come to the clinic for an assessment.
And we really create this, team approach to addressing those needs, as well as the housing, food, safe place to stay after surgery, pain management.
But people can walk and go about their life. We just try to have them avoid lifting very heavy things.
Yeah, but it's hard to be out on the streets.
Absolutely. Absolutely. So the ones that are willing and need a little bit more help, we have a lot of social services through some of the clinics that refer to us, and sometimes have been able to get people some temporary housing or sort of a medical respite type housing.
So tell me about the operation.
Okay.
How did that go?
It was wonderful.
Wonderful because shortly after the surgery, Lonnie was offered supportive housing. The program started a year ago, funded by the health department and a $100,000 grant from the San Francisco General Hospital Foundation.
This particular program, the REACH program, this is the only place in the country where this program is being tested. We are optimistic that it will be tested, piloted, and then scaled across the country.
This new model of care has improved the lives of 8 people so far. The intention is to reach more of those living on the streets who are vulnerable. Still, for Lonnie, there is one thing he has yet to get used to after living for so many years as a homeless man.
I suspect that you get so used to being on the streets that it's hard to live in a room.
And that's what I'm going through right now. I'm going through that right now. Really. Living in a room is driving me crazy.
Right now, time is all he has.
And the surgeries are the easy part. Reaching out to people who may need them is somewhat challenging because chronically homeless people aren't always reliable because there are so many other things going on in their lives, and many times they don't think that their health is a priority. It takes time and the right kind of people to gain their trust. If you heard that, it was so interesting how he said, I can't get used to these 4 walls, and that's what happens many times with people who live for such a long time out on the streets, since the age of 14.
It does take an adjustment.
Yeah.
Thanks,
Well,
Leanne.
that's a better problem than being on the street.
Yeah, absolutely.
All right.